I'm Kambiz Tajkarimi. I'm a board-certified urologist and cosmetic surgeon. I live in Reston, Virginia, and my practice is located in Leesburg, Virginia. A large portion of my practice is performing the Himplant, the previous Penuma, and also penile prosthesis, sexual medicine, and cosmetic surgery, including high-definition liposculpture of men and women, breast augmentation, breast lift, breast gynecomastia for men, and Brazilian butt lift, and total body shaping and contouring. I began performing penile prosthesis after my residency in 2008. Even before that, during my residency, I trained at the George Washington University Medical Center. In 2019, I was introduced and intrigued by the previous Penuma, the current Himplant procedure. I began doing them at the end of 2019. I'm proud to have done more than 500 Penuma-Himplant cases. Uh, I am very intrigued by this procedure, and we are pioneers of male enhancement in the world. Well, every day, every night, I meet men and their partners who are interested in improving the confidence of their partner or themselves by enhancing their penis. They have legitimate concerns about their girth or the shape of their penis. And patients come and talk to me and discuss their problems. The Penuma implant is a silicone-shaped device. The current technology has advanced tremendously, which is the new Himplant procedure, which is a device that is shaped and custom fitted into the penis to make the penis thicker and bigger in the flaccid state and thicker in the rigid state. It expands during erection. The advances that have occurred, I'm proud to be one of the surgeons who is involved in making this device better and more durable and more cosmetically pleasing to the patients. The vast majority of patients are extremely pleased with the cosmesis of the new Himplant procedure. And the key point for that in my practice has been continued improvements in surgical approach that reduces recovery and earlier return to sexual activity. My practice, I'm a solo practitioner. I have my own surgery center, which is dedicated to only cosmetic surgery. I typically am able to interview patients within 24 to 48 hours, and if they are qualified, we can book them very quickly. I typically perform about 8 to 12 implant procedures every week. Well, imagine, Ray, a patient is interested in the Penuma procedure, but they have large amount of fat deposits in their pubic area or their love handles, or they have significant gynecomastia, which is a large amount of fat around the nipples, which is called gynecomastia, or what we call the man boobs in a common terms. And I'm able to also aid them getting rid of these and make them look more athletic, more slim, more toned. Many men after the age of 35, their testosterone level drops, the level of metabolism drops, so they start gaining resistant weight around their torso, their love handles, and even with going to gym on a regular basis or having a good diet, they still can't get rid of it because these are fat deposits that just happen as part of aging. The good news is that with high definition liposculpture, we can really trim their waist, get rid of their love handles, get rid of their abs. Even I can produce a beautiful six pack for men who have muscle underneath, define their shapes, their curves, their ligaments, and also to develop their chest to get rid of the fat around the nipples and the breast tissues. So this is a all in addition, because if you want to get a Penuma implant and you have a suboptimal body, you may not gain the confidence that you are wishing. And I think they go hand in hand. Typically, the liposculpture needs to be done before the Penuma or the Himplant. Why? Because the amount of fluid that's introduced to perform the liposuction, you can't just do a Penuma the same day, or you cannot perform the Himplant same day because the fluid may cause swelling and potential infection. Therefore, I typically wait at least 1 to 3 weeks before I perform the implant procedure after liposuction. Erectile dysfunction is the inability to obtain or maintain adequate erection to your satisfaction. Erectile dysfunction is a common finding in men. More than 40% of all men in their 40s have erectile dysfunction, 50% in their 50s, 60 to 70% in their 60s and 70s. Penis is like a tire. There's two tires in your penis that fill with blood instead of air. And the vessels that feed the penis may be damaged because of diabetes, high blood pressure, aging, surgery. And also the ability of the penis to maintain the blood in the penis may be damaged by diseases, including pelvic floor dysfunction. So you may develop what we call venous leakage. Patients who develop erectile dysfunction may choose to have oral medications first, like Viagra, Cialis, Stendra, Levitra. If those medications do not work, you will need to see a sexual medicine specialist to evaluate you, to check your labs, make sure that you have no abnormal blood pressure, high blood sugar, abnormal cholesterol, neurological conditions. Once those are ruled out, we perform penile duplex ultrasound to objectively assess what's going on, and then we will give you treatment options that are available. For men who have severe ED, and they do not respond to oral ED medications, I think they should definitely fully educate themselves about the penile prosthesis, which has been around since the 1970s. It's an excellent procedure. It's an hour procedure performed minimally invasive way to return your sex life back to normal. That's a very good question. I believe the best candidates for implant are healthy men who are physically healthy, emotionally healthy, who just want to improve their cosmesis of the penis. They want to improve the girth of the penis. They want to make their penis maximally uh, pleasing to themselves in the flaccid state, and also the men who want to improve their erect girth. Most of my patients are fully examined for physical conditions and also psychological conditions to make sure that they are a good candidate for implant procedure.